And one of the things that I would love to see happen is getting patients in the ICU when they're critically ill on a complete and balanced diet. So it's one of those situations where, you know, over time, I think sometimes we'll tempt to eat with things like chicken and rice. And as a nutrition nerd, I've done the analysis, and it's deficient in 17 nutrients that a dog needs. So it's quite a few. And, you know, I'm not so worried about things like the minerals, because if it's short term, things will probably be okay. But things like B vitamins, those are water soluble. They really need them. And we know that an animal can't actually break down and metabolize carbs like in rice without B vitamins. So if you give them a bunch of carbs in white rice, it's one of those things, can they actually use it properly, or are we just going to see things like hyperglycemia because they're having trouble actually, you know, breaking it down? So I try to focus in on things like proteins that are highly digestible to meet their amino acid needs, and I want to make sure that I'm focused on keeping that lean body mass that we all have seen waste away when they've been in the ICU. And then I really want to focus on, you know, fat from the standpoint of palatability and calories, those sorts of things. And they need that energy. Oftentimes, if you can get them to eat something, they'll only eat very little. So as long as they don't have, you know, severe hyperlipidemia, like it's not a miniature schnauzer that you're treating, then go for something that's higher in fat and higher in protein to try to help them recover, and really try hard for it to be complete and balanced. So if you've offered all the different recovery diets and all the different GI diets, and you've really got the patient's nausea managed, and you've tried appetite stimulants, one of my tricks of the trade that I'll use to try to get them started, because animals are so focused on smell, is the tiniest pinch of Parmesan cheese, because it's not going to unbalance the diet, but it's very pungent. And so if you have a patient with congestive heart failure, please get the low sodium version. So don't put a whopping dose of salt on the patient's diet, but just something that little. I've also used just the tiniest drizzle of like maple syrup, being a Canadian, or honey for dogs, of course, not diabetics, not gonna work for our cats. They don't have their sweet taste receptors, but there can be these little things that you can add that are just a couple of calories that just get them to start eating, and then they take to the diet. And you know, it's about trying to figure out these little things that will work over time, because we do so much for our patients that I would love to see them all getting balanced diets. So it can be really hard, you know, if the dog or the cat has been eating just chicken, or maybe the dog's been eating some chicken and rice in hospital. I love when we stress that, you know, this has to be short term, because it doesn't have everything that the pet needs. And if you can send them out the door with the complete and balanced diet that you want them to be eating, with a transition schedule to get them transition, that's a really great opportunity for education. I've received quite a few referrals for cases in my career where, you know, they just would go on the chicken and rice when they had diarrhea, but then it became more and more frequent, and all of a sudden they're just on chicken and rice. And it's not going to be something that a dog can withstand being on long term. It's not easy. So if you have a healthy animal, it's going to be easier than if you have a patient with 5 or 6 medical conditions. I've had situations where I've had to formulate those diets, and it's taken me 5 or 6 hours to do the formulation if it's very complicated. And so it's definitely not something that we take lightly as nutritionists. It can absolutely be done. And so I will get the pet parent to measure out all the ingredients by weight using a gram scale, and I'll also get them to measure out all the fat using a syringe. And you can usually get fairly close. You'll never be precise like a complete and balanced food. My resident mate and I actually did a challenge where we tried to make the diets to see who could do it better, and we were just appalled at how far off we were. And these were nutrition residents that were competing. So you're never going to be exact. You're going to aim for the ballpark with a homemade diet. And there are supplements out there that are easy to add, that you can add to the diet to make it complete and balanced. So at least those are available nowadays. There's a few great companies with veterinary clinical nutritionists that make those supplements. Keep feeding your patients. You guys have done a great job talking about it at this conference. I love it. It's one of the biggest things to make animals recover. So great job, guys.